Do you have a stress fracture? Do you have radiating, aching pain on top of your foot or on the outside of your foot or in the middle of your foot? Well, we've got you covered with our stress fracture guide. Stress fractures develop specifically in runners along the metatarsals or the navicular bone. So this can happen in anybody. People who stand on their feet all day, people who develop slow, numb, achy pain, but runners are the most famous type. We're going to show you how to take care of this foot pain. Look at this foot. Underneath here somewhere is a stress fracture. It's hard to figure out how to diagnose this and where the stress fracture is. So a stress fracture is a crack in the bones right here, but it's not like a trauma where the foot dislocates and spreads apart. It's a dull ache that slowly develops over time and hurts more with the more you're on your feet. It can even hurt when you wake up in the morning. It can ache and just gradually you can't do the stuff that you've needed to do. So if you've ever had that happen to you, it may be a stress fracture. A stress fracture is officially an overuse injury in the bone. That means the bone, it's kind of like a beam that keeps bending. Eventually it starts to splinter and crack and doesn't have enough time to heal. There's something called Wolff's Law. Wolff's Law means a bone that has more stress will eventually get stronger, but if there's too much stress too quickly, or for some reason your body can't strengthen that bone, you can develop a stress fracture. So here we have 5 metatarsals. So 1, 2, 3, 4, 5. These are the metatarsals. Number 1. Number 2 is the longest. Number 3 and 4 and now 5. 1 and 5 have a lot of motion. So most are going to be in 2, 3, and 4, although outside of the foot can cause 5 to hurt. So 2 is the most common, then 3, then in higher people 4. Then if your foot's rubbing against the outside of the shoe, the 5th can be agitated as well. This is most common in runners, especially people who don't ease into it. So specifically, people training for marathons really start running quickly. People who have vitamin D deficiencies. So there's 5 common areas for stress fractures to happen. The most likely is the second metatarsal right here, because you can see when you compare them, it's pretty much the longest one. So when I bend it up, you could see right there, it's pretty much the longest joint. So longer than this one, definitely longer than this one. Sometimes this one can be a little bit longer, but you can see realistically, this joint is a little bit more forward than this joint. So as a result, most stress fractures happen through the second metatarsal. So what you want to do is you want to bend the toes down like this and see how the head is now prominent. You can feel that head. Is it hurting anywhere along this bone? Right there, no pain. Right there, you can see that head is prominent all the way up here. So it's a little bit further up than this one right here. So you want to feel along that bone. Usually that's where it's most tender. Then you can feel the third metatarsal, and then you can feel the fourth metatarsal, and then the fifth one, you can see how much that's protruding. The fifth one, you can see right here, it ends right there and starts right there. This can cause what's called a Taylor's bunion. So you want to press on that. That can be sore in runners. What you want to do is have a shoe with mesh here that's not poking out of. The next thing you want to do is you want to feel along the bone. It could be in the midshaft, the fracture could be in the head, but generally it's back here. If you sprained your ankle and you have an injury right through there along the fifth metatarsal, this could be what's called a Jones fracture. So this is a fifth metatarsal fracture. This is where soccer players like Neymar, or footballers for my European watchers, this is where Neymar broke his fifth metatarsal and led to some drama with this football club. A lot of NFL players get an injury here, but you can see right here, I drew a tendon. So this green tendon is your fifth metatarsal styloid process, and the tendon inserting here is your Peroneus brevis.
So you can see your Peroneus brevis is the tendon inserting right here.
The Peroneus brevis is responsible for inserting your fifth metatarsal and turning it out. But if it does it too hard, it can crack a piece of that bone off, leading to a fifth metatarsal fracture.
So if it hurts at the base right there, that's your fifth metatarsal insertion. Whereas right here, you could have a fracture or a Jones fracture, or through here, a stress fracture. So just to recap, right here, number 2 is the most common stress fracture. In high arched people, I see sometimes the base of the fourth metatarsal with ankle sprains where you can break a bone. This tendon, this Peroneus brevis tendon basically rips this out when you sprain your ankle like this. So you can see this tendon's right here. When you sprain it, it yanks, and it yanks this chunk of bone right here. So again, the way you want to test these are, you bend the toes down, you can see the heads become prominent right there, and you want to push on those and along the bone. You can now feel the bones right in the middle, and that's how you know whether you have a stress fracture or not. It's also very possible to have a fracture, a stress fracture through this bone right here. So you can see this bone, this is your navicular right here. So this bone's your navicular. So if your stress is through the top of the foot right here, and you're getting that dull ache while running, go to our navicular stress fracture guide. So that's through this area right here. So you can check the first metatarsal right here. How sore is this? You can now check the second metatarsal. How sore is this? You can now check the third metatarsal. How sore is this? You can now check the fourth metatarsal. How sore is this? And you can check now the fifth metatarsal. How sore is this? Right here. And you can see the tendon inserts into this area. So you can see the tendon coming right up there. It comes along the back of the fibula right there.
So the way to really diagnose a stress fracture is you have to see your podiatrist. And I'm biased as a podiatrist, but we then evaluate you, get your history. We start with an x-ray. An x-ray probably won't show anything unless it's been going on for at least 2 to 3 weeks, which most people, that's when they do come to the doctor. So we usually do see something. If I still can't see anything because a crack hasn't developed or it's so thin that you can't see it on x-ray, I love to use an ultrasound. So on ultrasound, you're gonna see bruising inside the bone. If we still are concerned, an MRI may occur, but realistically, the best diagnosis is us starting to treat it and seeing if it gets better. Then you pretty much know that's what it was. Losing weight, all that kind of stuff, everybody already knows that, and stop smoking, blah, blah, blah. I'm gonna give you the real practical, quick stuff. Number one, if you have a severe injury, you may have to stop what you're doing. If you're working 12-hour shifts, we can write you a letter to be off work for a couple weeks until things cool down. As much as I'd love to get you working through it, if it's a severe fracture, you may need a few moments off work. Same thing with running. You can cross train. You can switch to swimming. You can switch to riding a bike. Riding a bike is just as good for your cardio as running. You know, people think riding a bike does nothing for them because their joints don't hurt as much. Joints hurting does not correlate with burning calories or cardiovascular activity. If you have a stress fracture, it's not minimalist shoe time. It's great shoe time. So you want a very bulky supportive shoe. So you want a stiff heel, you want a stiff sole. Look at that, I can barely bend that. And I can't bend anything here. Another thing I love is great orthotics. So specifically for a broken bone, you want to get a stiff orthotic where your toe can't bend, especially if it's the front of your toes that are bent. So carbon fiber insoles, some of the links are in the show description. But the next thing you want is you want a good orthotic. So a great supportive orthotic, you can see, will take pressure off the foot. So I go over this in a lot of videos, but for time's sake, just take my word for it. Studies do show a lot of pressure is taken off the front of the foot and the metatarsals when you're wearing a good supportive orthotic. For stress fractures, I like an over-the-counter insert because it's a lot softer. Now's not the time to try and adjust to a hard orthotic. I'm a big fan initially, ease into the softer insert, not the hard insert. Hey, guess what? We have a phenomenal book. I believe this is the premier book on chronic nerve pain and peripheral neuropathy pain on the planet. I've put years of work seeing tens of thousands of peripheral neuropathy patients, working with some of the best diabetic endocrinologists, the best doctors, the best neurologists, in building out this book. For you, my viewers, we have a discount code available. Get on our mailing list and get that book down here.